You'll notice after surgery that you have an A-strap with some gauze layers underneath. We want you to keep these in place for 3 to 5 days, but after that time you'll need to remove these and put some waterproof bandages over your wounds. You'll begin by removing the A-strap, setting that aside, and then removing the gauze. When you remove the gauze, there's a gauze roll that first needs to be removed, and then there are some 4x4-inch gauze bandages underneath. All of this can be disposed of. Now you'll see your wounds with sutures, and it should look similar to this, especially if you've had an ACL reconstruction. Some larger wounds may be there, as well as some smaller wounds. You'll start by taking whatever size seems appropriate and placing that over each wound. You'll see that one side is paper, the other side is plastic. You'll want to begin by removing the 2 paper layers on the bottom side, which will reveal the gauze pad in the middle and some adhesive around the edges. Carefully place this over so that the gauze is over the sutures. This will prevent the sutures from being tugged on when you remove those to either replace them or when we remove them in clinic to cut your sutures out. There's a plastic backing that needs to come off after this as well, so make sure you don't forget to take that off. Now you'll see an example of a larger post-op site, and this would be used over a large open wound. It is much the same. Remove both of the paper backing, and then you can place it wherever it needs to go. It's possible after you've placed these that you may have some edges that want to dog ear up off your skin, and if that happens, as shown next, you may want to replace those so that you don't get water underneath and you keep everything dry. It should be noted that we can't review what the incisions would look like with every surgery, so this is just one example.